Hello, everybody. Today we have with us Dr. Shawn Ryan, who is the Chief Medical Officer of BrightView Health. Dr. Ryan, thanks for your time today.
Thank you for having me, Kris.
So you're a Northern Kentucky resident. We're sitting in the middle of a pandemic and all the ramifications of that. But prior to that, we had an epidemic of addiction, overdoses that have really just hit our entire country for so long. And I'd like to just get your update on where we are with that. But before that, maybe give us a little bit of background on yourself. Go ahead.
So as you said, I'm the President and Chief Medical Officer of BrightView Health. BrightView Health is a multi-site, I think we're up to 25 sites across Ohio and Kentucky now, all outpatient addiction treatment, very much focused on compassionate care, science-based treatment, and utilizing, meeting people where they're at with individualized plans. Background on me a little bit. I'm a board certified emergency and addiction physician. I trained at the University of Cincinnati for residency, did my MBA there as well. Got out and like many people just saw this epidemic unfolding, both at the ground level where I was working in the ED for a long time. And then, personally, family and friends, and also have done several years of state and federal work, kind of in the statistics and epidemiology space. So really the 5 and the 50,000 foot view. And through that, developed BrightView Health because I couldn't find good help for people. Working in the ED, I would send them out, overdose, after an overdose, try to get them connected. It didn't happen. They'd come back over and over again, and often they would come back and unfortunately passed away. So, launched a small clinic in Norwood several years ago. It's expanded with those core functions, and we're now one of the biggest providers of these services in this area of the country.
So, and this has evolved, right? Every year you learn more, you figure out what works, what doesn't work to help those who are in addiction. Maybe speak to that, going back to the pre-pandemic timeframe, when we were in that quasi-normal world. What did addiction look like then, and then compare that to the patients you're seeing today?
Sure. So a couple of important points. First and foremost, what we were seeing nationally, but especially in this area, in the tri-state, was we were actually starting to crest the opioid overdose rate, meaning we felt like we had gotten kind of to the top of the mountain. Problem being, we were still at the top of the mountain, right? So it was a long way to go down. And we felt like we were making progress with kind of 2 key functions. It's much more complicated, but we were giving a lot of naloxone out, which is the right thing to do. And we were getting a lot of people into evidence-based treatment, including medication-assisted treatment. And so through those efforts, specifically in Hamilton County, we tracked some substantial reductions in overdose deaths until COVID. And what unfortunately happened, Kris, was, if you go to any textbook or any addiction expert and ask them what are the factors that you don't want your patients to deal with, or barriers to their recovery, or make addiction and mental health worse, and that is clearly, it was clearly the entire list of things that were going to happen with isolation due to COVID. Yeah. Transportation issues, barriers to treatment by that definition and others, people having to isolate themselves, which is the absolute core issue with addiction often, is people isolate for a lot of different reasons. Depression and anxiety increasing, financial struggles. I mean, it was just unfortunate. Like if I were to sit down and write a list, it was going to all happen, and unfortunately did. And so now throughout the country, and specifically in Ohio and Kentucky, we're seeing increasing rates of overdose again. And so we're trying to figure out, what do we do more of the same, which is probably the answer. What else can we do? One granular example is we were giving a lot of naloxone out of the jails. Well, jails are pretty much closed up right now, as they should be. But that was a very important intervention that we were doing that we're struggling to maintain right now.
So, the other issue that people have pointed out, 2 quick questions, one of which is the fact that overdoses in general have been going down, even though you're saying that we've seen this bump back up, but having to do with the type of drug that those are addicted to. So it's not so many, we're not reducing the number of those who are struggling with addiction, but the drug that might have killed them before is changing. Can you speak to that a bit?
Yeah, so in this area for a long time, and in contrast to several areas of the country, we've been very fentanyl pervasive, right? So 93% of all of our patients that come in are fentanyl positive, even if they don't know they're using it. So that's actually why the overdose deaths we're getting so much worse over the past few years. That actually hasn't changed too much, with one exception. We're seeing a resurgence of methamphetamines and stimulants, right? And so people are asking, well, what do you do about that? It's not just the same old medication assisted treatment and kind of the holistic model. That's correct. But at BrightView Health, we treat everybody. We treat people with alcoholism and people with marijuana addiction and all of these things. So for us, the shifting drug use doesn't change our model very much. So I'm board certified in addiction, not in opioids. It just happens to be that I know the most about opioids because of the past 5 years of focus. And so we have evidence-based interventions like contingency management, and there are some medications we can use off-label that can help or also addressing their mental health needs, which often lead to the methamphetamine use. So we're seeing that shift. It is a problem, Kris. We don't have really good medications for it yet. The FDA is working on that approval. I'm on the panel to do so, but they're struggling to get where they need to go with those right medications. It's complicated. I just really hope in the next few years we get that so that we can round out that 3-component model of medical, psychological, and social treatment.
So go back to the pre-pandemic numbers where, economy's booming, seeming like our unemployment was so low. People would ask me and say, Kris, why is this a big deal? People can go get jobs. Why would anyone ever start? And the answer I would first tell them, well, a lot of the cases in that time were starting up because people were becoming addicted to prescription medications, and some of the people weren't aware of how addictive those could have been. And that was, we could get our hands around, in my mind, that was a reality why people would be needing to basically fill that high. Speak to that for a second. And then now we're in this case where unemployment has been dramatically increased. Do you see a difference there? And does it make you worry about, in this position of the economy where we are with employment?
Yeah, good questions. So to your point, we know that approximately 75% of folks who are addicted to opioids started with a pain prescription, right? Whether it was too much or not is a whole longer debate. Probably we were handing it out too much for several years, probably 15 plus years. But the point of that is opioids are one of the few drugs that just cold stone abstinence from them without medication and a holistic plan doesn't work. It doesn't work more than 5% of the time. So very bad rates of success without the whole program, including MAT. And that's because of the way that opioids work in the brain. They're very unique. We have a lot of endogenous or internal opioids that our body utilizes, produces, et cetera. So it's a pretty complex system. And when somebody gets dependent on opioids, this has been known since the 50s. Just telling them to stop doesn't work. And there's a lot of confounding things associated with depression, anxiety, as well as pain, to your point. So I always tell people, somebody's on heroin because they got hit by a truck and then pain pills, blah, 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 heroin. That doesn't mean if I get them off of the heroin that they didn't get hit by a truck, right? Like they're still broken physiologically, a lot of back problems and leg problems and such. So it's pretty complicated. And I'm here to tell you, I've seen thousands of patients in this field. There is almost never a case in which a person can just stop, quote, cold turkey, which actually is based around the withdrawal from opioids kind of historically. On the employment front, it's very concerning. So we do a lot of work on our social component of our program, getting people back to work. I think everybody knows, those who don't have any addiction right now that are unemployed or less employed, whatever that means, are suffering from issues, financial struggles, depression, anxiety associated with that. And so it's not a surprise at all and we do have reduced employment all over the place. People in addiction that were previously using that as an anchor as part of their recovery, which we support and encourage, they're struggling. I've had interesting conversations with patients I never could have foreseen. As an example, I have a very old, not very old, but an older patient who spent a lot of time in prison. And he almost lost his kind of journey to recovery because he had to stay in his house for months, basically. And he said, I felt like I was back in prison. I couldn't get out and do the things I was doing. I couldn't work like I was working. So it's been a struggle for people, both, and again, makes sense if you know about addiction. And also you talk to patients like I do every week, and it's real. It's a real concern.
Well, and we could literally talk about this topic for hours and hours, days and days, experiences. But let me just maybe take to two final points, one of which is, we sit here, end of 2020, any advice you have to those who are, maybe we were aware, connected to coworkers, family, to give advice on how to support those who may be going through addiction? And maybe if you could maybe give your comment on, what do you think about the whole idea of the stigma? Is it still there? Or are you seeing more of an awareness of the fact that we're in this situation where people are struggling with addiction, whatever type, and maybe advice on how to help people get through that.
Yeah, those are questions are kind of connected in my mind. So first and foremost, take advantage of technology if it's available. Do stuff like this. Like probably, Kris, if we were going to do this a year ago, we'd have hung out in the same office and like had a conversation and been recorded that way.
Yeah.
But use technology when it's available and try to find those mechanisms. So some people can't afford, broadband and stuff like that, but there are support mechanisms to pay for that out there. Those are really important. And recognize that telehealth, as it was a smaller part of medicine before, is now a huge part, and it is just reality. So I now see patients just like this in their home, an hour and a half away from my home or office or wherever, and we do fine. You know, especially for a lot of the more psychological parts of medicine, like addiction treatment, we can e-prescribe or electronically prescribe the appropriate medications. So don't think because your treatment center is, less accessible because they've reduced groups and stuff like that, that there's not alternative support mechanisms out there. There's plenty of telehealth on the medical component. A lot of the recovery support groups, NAAA, Smart Recovery, have moved to online. There are platforms and apps like Sober Grid that people are flocking to. It is just reality that we have to shift to this a little bit less connected environment. But what I want to encourage people, friends, family, and patients to do is not forget that there are things out there. We're not shut down. As an example, BrightView Health is not shut down. You can get online, you can call us. We'll see you today, tomorrow, whenever. We're happy to maintain that and engagement and do a fully virtual treatment program to the best of our abilities, which is a new thing for us. On the second thing, and you were saying about, what can we do more so connected to other resources and whatnot.
And keeping people from maybe going into addiction at this point with the world we're dealing with right now.
Sure. Again, transparently, Kris, we're looking at the alcohol, the opioid use, everything is going up, but the reasons are very, very clear. Anxiety, depression, financial struggles, transportation issues, and people are turning more so than they ever have to drugs and alcohol. And so knowing that treatment is out there and easily accessible, and again, making sure that they're taking advantage of this type of interaction that is present can work on the second part of your question about stigma. So to some extent, treatment is more accessible and more anonymous, right? You don't have to go into a treatment center anymore necessarily. Sometimes you may have to show up to pick up your medications or something like that. But for those who are really trying to maintain their anonymity, which is a large portion of the population, I can see somebody just like this, and nobody ever has to know, not their family, not anybody at the treatment center. They don't have to drive there. That being said, some people need in-person interactions. So we're still doing in-person groups, just distance, mask, cleaning, everything that we have to do to be compliant with the health department's recommendations. But for those who are looking to deal with that stigma, and that's the primary barrier, it's gone, it's gone basically. I would say people's opinion on stigma has gotten better over the years. I think probably a little better, but it's a slow road. It's a slow road to change the public opinion.
Well, Doctor, I really appreciate your time and your great work. And I know you and other organizations, other hospitals, other private agencies, other public, everybody's trying to do the right thing and get people on a track for success and long-term health. And I know you've done a lot to add that to our community. And as a Kentuckian, we're proud to call you a Kentuckian, right? So one last point, one opportunity. Anything else you think of right now, if there was one thing for people to take away from our comment here about what you see daily, what would it be?
Stay connected. It's interesting. People are more disconnected, but have more potential to be connected than ever. And again, I recognize you can't go hang out with everybody you want to hang out with, but stay connected. It is a core function of human reality, right? And so, talk to people, use technology or find it as you need to, and make sure you just keep yourself sane.
Well said. Thanks, Doctor. Have a wonderful day, and thanks for your time.
Thanks, Kris.